proud to that short commercial break. I told you that we're going to have a conversation about how to feel and live younger after 40 years. They say life begins at 40, and so for everybody after 40 years, follow the conversation with me this morning as I speak to a CEO for American Rejuvenation Clinic, Tyrone Jamar, and Anope Menino AD and Komo. The conversation would be in the English language, but Tyrone, we are the Anope Metete, Rebecca Trigakra, and to Trina and Huntia, I was over here in the. So we were having a conversation about your health, living a healthy life and the ways to, achieve that, the tricks in there that you'd need to pick up this morning as I speak to Tyrone. Tyrone, good morning.
Good morning.
Now, it is saying?
Yeah.
You spoke in one, so that's okay. Anyway, so let's talk a bit about your outfit, your entity, before now we zoom into the proper conversation. So tell us a bit about the American Rejuvenation Clinic. What do you do?
At American Rejuvenation Clinic, we are a preventative medicine clinic. So that means that we try to prevent people from developing chronic illnesses. Also, we are into anti-aging and hormonal replacement therapy, as well as other general healthcare things for men and also women.
Okay. So when you speak about specialty, what do you mean by that?
Our specialty is we have specialists in-house, which are GU, urologists, gynecologists. So our specialty is our niche is into the sexual health and also the anti-aging aspect. That's our strength of our clinic.
All right. Now, I know for most of us here, we only go to the clinic when we feel sick or our bodies are telling us, no, something is not right somewhere. And so the thing would have happened before we go to the clinic. If it's malaria, I would have the malaria before I go to the clinic because I would have seen the signs and symptoms before I go to the clinic. But you spoke about preventative health care. What does that mean?
Well, a lot of times, sometimes we don't always see the signs and symptoms. Sometimes you can check blood work. There's certain things like your PSA, your prostate health, checking laboratory values such as cholesterol, blood sugars. These things, if caught early, if controlled early, can stop the cause of a chronic disease like diabetes or prostate cancer.
All right. So the more interesting part of the conversation, a lot of people are afraid of aging, and you see some people 30 years, 28, and the stress of life makes them look like 50, 60 years. So let's talk a bit about anti-aging and, what we ought to do to keep ourselves looking younger and, always looking refreshed. What goes into it, this whole anti-aging conversation?
Well, there's lots of things that we can do from the natural aspect, such as get sleep. The stress you just spoke on is an important factor. So reducing our stress, maybe we add leisure activities or some free time. Also, water intake, diet, and exercise are huge things that can help us preserve our life and also live a quality of life for a longer period of time. From the medical side, you do have, as we age, we have our hormones that play a huge factor into symptoms of aging, which I know we've heard of these terms of menopause and andropause. So there's a medical aspect as well. But we always have our laboratory values, our cholesterol, and these hormone levels that we can check at a clinic or a laboratory scientist place.
All right, now the exercise you spoke about, and I'll use myself as an example, and I know a lot of people will fall within my category, where we have a very monotonous lifestyle because of our kind of work that we do. So I'm here at 5:30, and so I should be up, let's say around 3:30, 4 a.m. thereabout to drive and get here. And I'll spend my entire day here because by the time I'm leaving here, let's say around 2:33 p.m. thereabout, I'll get to the house and it's already 5 p.m. or almost 6 because of the traffic situation. How do I get to exercise when I have this lifestyle?
One thing I tend to do, because a lot of times I do spend time in the office, you can get up and walk around your own environment. You can walk around your your lunch break, or if you have free time, you can walk around the facility or wherever you work at. Maybe walk down in, the block. But those are things that you can do exercise wise.
Well, I think that there's a bit of misconception when it comes to what people consider as exercise, because here you are as a professional telling me that exercise also means that you get up from your desk and you walk around your building for a bit before you come and sit again. But mentality people have about exercise is going to the gym, lifting a few weights here and there, running and all of that. Do we really understand what exercising is?
Yeah, I think what you said is correct. There is a misconception on exercise. Some people confuse it for bodybuilding or what other activities, CrossFit, but really it doesn't have to be heavy. We can do simple things just to keep our bodies active. You don't have to jog, you can walk. You don't have to lift weights, you can do aerobics. There's multiple different ways to achieve a goal of really it's all about your heart. You're trying to exercise your heart, pump some blood. So anything we can do to get our heartbeat elevated, to strengthen our heart.
Earlier when you were speaking, you spoke about andropause and you made mention of menopause. As for menopause, we have had it, but what is andropause?
Well, andropause, men go through a similar condition as menopause, which is called andropause, and where the hormone levels fluctuate. So the female system is ran off of predominantly estrogen, and they do also have testosterone, but it's at a lower rate. For males, it tends to be our testosterone drops down very low. Our bodies are ran off of testosterone as the male hormone, but during andropause, our levels start to decline, and sometimes the estrogen levels start to increase. So it comes with a whole list of symptoms such as erectile dysfunction, low energy, low metabolism, memory issues, also weight gain. It's a lot of different issues that come with that.
But at what age does it set in?
Each individual is different, but usually the average age is around 40 to start looking for signs of low testosterone.
40 years?
Yes, 40 years.
Wow. And then menopause starts when?
Around the same time.
Around the same time. 40 years, a woman could have menopause at 40?
Yes, she can.
Wow. I thought it was around, let's say, 60 years there.
That's 40 is when I say menopause, there's symptoms where you start to fit into the category where with menopause, your hormone levels start to how should I put it? You emit less hormones. So a woman starts from 40 years going. Once she can reach full menopause at a different level, so maybe 50, she can reach full menopausal state where her, she's no longer having menstrual cycles. Her hormones are no longer active. But that's treatable now.
It's treatable.
The symptoms are treatable, I should say.
Okay. All right, now let's go back to the men issue because you just kicked me a little bit there. I thought it was going to be around like the 60s and all, but 40, we all need to look out. So if someone is forgetful, there's a bit of memory issues, he puts the pen here, he can't, remember this is why I left the pen, Are those signs to look out for?
They can.
Or they are natural. It happens.
They can be, but we all have. I think even me myself, a lot of people we have issues remembering. But the thing is, there's such thing as short-term memory loss. There's a lot more advanced forms of that, where everything is like you forget everything. But it's normal for us to forget at times. where do we put our keys? You know,
Yeah,
that's a common one.
Yeah.
Where do we put our keys at? Or, oh, did I turn the light off? I can't remember.
Yeah.
But so that's normal. But there's certain things that you'll start to realize, hey, it's starting to get worse. And it's not always that it's hormones that are causing that, but it's one of the symptoms.
Because I had to ask, because sometimes I'm a bit forgetful. I'm like, hey, am I getting andropause now? And so I had to ask. But let's talk about the treatment you mentioned for the symptoms.
Mm-hmm.
Now, how does that happen?
Well, for those who are suffering from, I would say, chronic issues, which that would be there's a range of where your hormones are. That's why I say it starts at 40 to decline, but it ranges. So we don't treat it until it gets to a chronic state. So once it gets to a chronic state, then we can do hormonal replacement therapy, which we can boost the hormone levels up. But first there has to be a comprehensive assessment done to make sure what exactly is causing the decline in hormone production.
Now, to the all-important issue about what should trigger somebody to come to you for these examinations. At what point do I decide that, no, I need to go see Tyrone and the team?
Well, first of all, they won't be seeing me. They'll be seeing the
team.
Yeah, they'll be seeing the team, yeah. But some of the symptoms, or some of the things that you may have to look out for, if you are replacing for your natural performance, such as men's sexual performance.
Okay.
If you have to take a pill or you have to pop pills every time, to perform, then maybe, you want to look at the root cause of what's causing that, rather than taking the medication to always perform in the bedroom. Another thing would be very low energy. If you notice that you struggle to get out of bed every morning, it's just a struggle. All of a sudden you're putting on weight out of nowhere. These are all signs that you should come and get yourself checked out.
Now, I know people would ask the question, is it expensive, coming for, all these processes and procedures and consultations and all? Is it expensive?
No, even though our office is located in East Legon, so it scares people sometimes. Yeah. But our prices are very affordable, to be honest. Just for a screening, for a consultation is only 200 CDs or something, okay. 250 CDs, I may believe. Okay. But it's pretty affordable.
Okay, all right. Now, I just had somebody send me a question that are there natural ways, to avoid this whole aging thing? Are there?
Yes, you can't always be certain, but there are ways to kind of push it away, which are what we talked about earlier, the extra staying active. That plays a huge role into your hormone production. Sleep is a major one. People who don't get enough sleep, at least 6 hours of sleep a day, that's a huge, also another hit onto your hormone system. Drinking water, taking the necessary nutrients. A lot of us don't eat our vegetables, so if you're not eating vegetables or fruits, then you need to be taking some type of vitamin supplement. So just a healthy lifestyle in general can help us prevent some of these things from happening.
All right, quickly, a texter just sent me one, and he says, Sami, I'm enjoying the conversation with your guest. He mentioned East Legon. Can you ask him to tell us where specifically, and if there is a number would have to use to contact them? I'd be grateful. So people want to know about where you are, and if there's email, website, or social media presence, anything like that.
Yes, we have, the location is actually 64 Garden Street, and that's in East Legon, opposite Agape House, just about 500 kilometers from A&C Mall, in between Malcolm and A&C Mall.
Okay.
We have a website, www.americanrejuvenationclinic.com. You can type it in Google. We have several numbers listed on Google. You can even access the Google Maps. It'll take you right to the location.
All right, but how about social media presence?
Yes, we have Instagram, American Rejuvenation Clinic on Instagram, Facebook, also LinkedIn.
All right, so in ending our conversation, what would be your final words to anybody who is listening or viewing us this morning?
I would just say to everybody to please, let's take our healthcare serious, and especially with this, you see the prostate and COVID. I mean, prostate cancer is taking a lot of people out early. COVID going on right now, so let's take our healthcare serious and screen ourselves properly. Don't wait until 3-4 years after you're feeling symptoms, something's hurting you, or you feel weak. Come and just get some laboratory work done. Check yourself out thoroughly every year, especially after 40.
I'm grateful you made time to join me this morning, Tyrone.
Thank you. I appreciate it.